So my question is, do mental patients need spiritual guidance or some form of spiritual practice?
Yes, but more immediately they need medical help, mental help, to stabilize their condition or their forces, the body-mind alignment, so that they're able to conduct the business of spiritual practice for real and with the hopes of good results. Well, because we can say spiritual practice has a lot to do with states of consciousness, maybe states of consciousnesses. And people who are mentally stable are having a problem ascertaining what their state of consciousness is and what it should be. They may not be able to determine their state of consciousness for real or for sure. And they may be overwhelmed by states of consciousnesses. So they're two different dynamics. Mental instability, uncertainty, confusion, self-division perhaps. And then, what spiritual practice is about is mental stability. And then the let's say, approach to understanding your consciousness is a step on the path. You go beyond that step. So it's not an escape, except in the case of serious neuroses, which a lot of people have. A lot of people are determined to handle that neuroses. And in the process of their practice, they handle the neuroses. And they vanquish it, they destroy it. They're able to enter the clear, which is often the plateau where spiritual practice then thereafter begins properly.
So you would say there may need to be a certain foundation that somebody would need to have before they get into the spiritual, or
you have to be ready for spiritual practice.
Mm-hmm.
Yeah. Yeah. And neurosis, we can agree, is a constant in a manner of speaking.
Yeah, sure.
Yeah. Some people use it, some people can use it and are used by it. Some people show up as the problem, which is neuroses. Other people use the neuroses, like artists can use the neuroses to straighten out their lives, straighten their minds out, and get their job done, get their work done. Yeah. But because a person's an artist doesn't mean he's a master of his neuroses. Because if he's confused, he's obviously a victim of neuroses.